Good morning, Lion family. My name is Michelle Biggs, and I am the Executive Director of Alumni Relations here at Southeastern. I welcome everyone back to day 4 of our Coffee with the Dean series. These have been really fun all week, and we're really excited that the Alumni Association has decided to put on these webinars so that we can all get some updates from all of our colleges and hear from all of our deans. And of course, this is part of our Homecoming at Home week for our alumni. And even though we're not together in person, we can at least celebrate Southeastern virtually. So I welcome everyone. Before we get started, I just want to tell everybody a couple of housekeeping notes. All of our attendees are in attendee mode, so we can't hear you, we can't see you. But if you do have a question for Dr. Carruth, we invite you to add it to the Q&A, which is at the bottom of the screen. And when we get towards the end of the interview, Kaylee will be reading all of those questions, and we'll try to get to as many of them as we can. So to get started, I'm going to introduce our panelists today. Dr. Ann Carruth received a BS in nursing from Southeastern, an MSN degree from the University of Mississippi Medical Center, and a DNS from the LSU Health Sciences Center. Dr. Carruth has been a nurse educator over 25 years, emphasizing evidence-based course development, accreditation, faculty mentoring, and student success and retention. She currently serves as Vice Chairman of the Board of Commissioners for North Oaks Health System. As the only nurse on the board, she serves on Quality Council to address performance improvement and emphasis on patient safety. Her funded research projects have resulted in numerous awards, including the Southeastern President's Award for Excellence in Research and induction in the Louisiana Nurses Foundation Hall of Fame. And today's student reporter is Kaylee Norman. She is a senior communication and media studies major, and she plans to graduate this December. She works as a news reporter anchor at the Southeastern Channel and recently won the National College Coronavirus Coverage Award for reporting, anchoring and producing for the North Shore News Update Coronavirus on the North Shore segment during the quarantine. She has won a first place regional award for television feature reporting given by the Society of Professional Journalists and has been selected as second in the nation for Best Television News Magazine. From Mandeville, Kaylee plans to secure a multimedia journalist position out of state after graduation. So welcome, and I now turn it over to Kaylee.
Thank you so much. First of all, I'd just like to thank you, Dean Carruth, for joining us today. I know you're a very busy woman.
Thank you for having me.
And second, I just want to congratulate you on the Southeastern School of Nursing winning the top nursing award in the state, the Nightingale Award. Congratulations, that's very well deserved.
Thank you. We work really hard. I'm very proud of our faculty and our students for the award. Thank you.
That's great. So we're going to talk a little bit about that in a little. First, I just want to start off with my first question. COVID-19 is still affecting our world today, and that seems like it's not really going to change anytime soon. So what are some of the challenges that your department has faced during the pandemic starting in March and up until now and beyond that?
It's hard to believe that it's only been March that we've been experiencing it because it feels like a very long time. But, we've had a lot of challenges because our programs that we have under the college range from internships, practicum, hospital clinical experiences, in-lab experiences, and then of course our didactic or classroom experiences. So at the beginning of March, we had a really, lots of challenges with making sure that our students got the kind of educational experiences that they needed, not just remotely with using Google Meet and other virtual, modalities, but also making sure that they got what they needed in place of those on-site experiences that we know are so vital to making sure that we get trained. So we did a tremendous, moving a very large ship in a very short period of time to accommodate our students for virtual counseling sessions, virtual speech pathology sessions, our nurse practitioner students engaged in a lot of direct patient care through either Zoom or other types of virtual technology. So we just had a lot of experience. A lot of experiences changed very quickly, and we did the very best we could at getting every single student to get what they needed, so they did not have to have an incomplete. And we did everything we could to make sure that we were meeting the accreditation standards, so that our programs would not be in jeopardy. So it was complex and very challenging, but we got through the spring semester, and we thought we were going to be able to have a little bit of sigh of relief going into the summer, but that wasn't the case. But by then we had a lot of experience, made a lot of great contacts. And, so going into the fall was a little easier. Still had some challenges, we're still facing challenges every day, but we feel like we're in a lot better shape now than we were in March.
That's great. So I just want to revisit the Nightingale Award that coincides with the 2020 International Year of the Nurse and the Midwife, which is quite ironic considering the value and the sacrifice that nurses and health professionals and officials have had to make during this pandemic. But Southeastern's undergraduate and graduate nursing students were both recognized. So first, let's talk about the undergraduate program. Why was it recognized as the top program?
Well, we put together a very extensive application, and it was sent out to a panel of experts outside of the state, and we were judged against other schools of nursing in the state. And I would like to think that we won, not only because we have phenomenal students who do really well on passing their NCLEX RN exam at the time of graduation, which is one of the questions they ask, but they also ask about our involvement in Student Nurses Association and our professional organizations. They ask about, a lot of our community outreach and what we do to help give back to the communities. And they ask about, various types of statistics. So it was probably about a 15-page application that we put together, and was very, very proud of the work that we've done. We included some things that were unique, I think, that made us stand out. We've gotten some really big grants, that one in particular that focuses on veterans and trying to recruit more veterans into the program. We also have another grant where we're working on telehealth and expanding our telehealth capability at Southeastern and beyond. And then we also have had some interesting fundraisers, like we love our annual Canine and Cupcakes event. So we think those kinds of things helped us a lot. And then just the types of outreach that we do, the students all have a capstone project in their senior year, and they go out and address community needs. And so I think that all of those reasons put us, made us very competitive, and thankfully and appreciatively, we won.
Well, I want to come back to the Veterans Grant and the telehealth program, but first, let's focus a little bit on the master's degree in nursing, which I did not know until reading that the master's program is offered in a consortium with 3 other state institutions. So how common is this consortium approach used, and whose idea was it?
Well, that goes back quite a ways, but in terms of the number of consortiums that there are that offer a master's in nursing, it's not very common. I think I've been able to find 5 other examples in the United States where a group of universities come together to offer a single degree program collectively or together. So we're in a consortium with ULL, McNeese, and Nicholls State. So it's been in existence for quite a while. We started, I think, in 1986, and it was funded through HRSA grant, and it has been a model that the Board of Regents has really liked talking about, promoting as an example of how you can pool your resources and share experiences and share expertise to offer, offer a degree program that benefits a lot of students.
That's a great way to merge resources, I think. So another thing about nursing program, is it true that Southeastern offers a completely online RN and BSN degree program that allows registered nurses with an associate degree on a nursing or nursing diploma to complete courses for a bachelor of science in nursing degree?
That's correct. So yes,
Okay.
we have a what we call an RN to BSN program. Yes,
Okay.
and it's completely online. It's 31 hours, and a nurse who is very busy and typically is working and typically has family. The benefit of having an online program is that they have the flexibility to come back and be able to enroll in those courses and be able to complete them in their own time frame. So we have it's unique to other programs in that we try to match up our RN students with a mentor, and that mentor will work with them very closely to get them registered, to get them get their coursework tailored to areas that they need to learn more about, and then to find projects that really help them in their current job that they hold, and to really give them a good experience that is meaningful to them and in the job that they're actually having at that point in time. So yes, so they can finish in a year and get their BSN once they start the program.
That's awesome. So one last note about nursing. According to an article in the Nursing Times, the U.S. Bureau of Labor Statistics projects 11 million additional nurses are needed to avoid a further shortage. So employment opportunities for nurses are projected to grow at a faster rate, to be exact, 15%, than all other occupations from 2016 to 2026. Which is great news, especially when it comes back to what you said about the Veterans Grant. So tell us how this Veterans Grant works and what kind of response you're having from it.
Well, good, thanks. Well, it is a grant that recruits current veterans into the nursing program. And so it is a grant that there are individuals that go out into the community and meet with veterans and then work with them in terms of their coursework, their preliminary coursework to make sure that they are successful in being admitted to the program, and then work with them throughout their the 5 semesters of the nursing program to make sure that they complete through graduation. And what we're doing with the veterans, which is unique and somewhat of a pilot program, but up to I think 20% of their clinical will not necessarily be in an acute care hospital facility. It'll be what's called primary care. So it's a way for us to demonstrate that nursing students can be in a different environment for clinical and still get the skill sets that they need to be successful as a nurse when they graduate. And that in turn will help us be able to admit more students and be able to train more students if we can find some creative ways to to get them through so that we can contribute to making sure that we have enough nurses for the future.
Okay. Let's switch gears a little bit and talk about the telehealth program that you had mentioned across campus. What exactly is this and how does it affect students?
Well, we're in the very beginning stages of getting it up and running. So it's really kind of a two-pronged program. We want to train our current students in telehealth, and telehealth can be electronic health records. It can be providing care to patients at a remote site. It can be home monitoring where you're connected to a computer, a cloud-based computer, but everything that you do with that equipment is recorded and then monitored by a healthcare provider. And it can be as simple as a phone call even, or FaceTime. So during COVID, the government has really changed the guidelines on what telehealth can be. And they've allowed telephone calls and FaceTime and, so they've really been more lenient about what would be considered telehealth. But telehealth is actually a very rigorous, you have to have a lot of security, confidentiality. You have to make sure all that's in place, but it's basically remote care. So whether that's a counseling session, any kind of session, or you can actually listen to someone's heartbeat remotely. You can look in someone's ears remotely. You can look at skin. You can actually do diagnosis of skin cancer, for example, remotely. So your provider could be in another country. Using this equipment, you can assess and take care and treat patients using the equipment. So we not only want to train our students so that they're better prepared when they graduate, but we're also wanting to provide that training to the community because it's such a new area for healthcare providers, but it is a rapidly growing area, especially as a result of COVID-19, that we're looking forward to being able to provide training to healthcare providers as well.
That's awesome and super exciting. So I had a lot of fun reading about the Anatomage, table since I'm extremely squeamish. I can't imagine experiencing that. But for those in our audience who might not know can you explain what this table is?
Yes, Anatomage. I saw it at another university, I don't know, a year and a half ago. And it was in a physical therapy department at that university, but I brought back the idea and started talking to our athletic trainers about it because so much of the work that we do in health sciences, not just in athletic training, but nursing and kinesiology, our communication sciences and disorders program does a lot of anatomy, physiology with head and neck. So I knew that this would be a piece of equipment that all of our students would benefit from. And basically it's the size of a dissection table. So it's fairly large and it is completely virtual 3D. And when you look at it, you are looking at a real human being that has been dissected. So we have a female version and a male version. And you can, it's computerized. So if you were actually dissecting a human being, you would go down layer by layer by layer. But with this machine, you can do it virtually. So you can go from seeing a person who would look like they were on a table. And by the end, it would be complete, nothing more than just bones. So, and it's anything in between. So, and you can zoom in and you can look at certain parts of the body. And so, I mean, there's nothing like dissecting a frog or, a human. I mean, of course, but this is the best, the next best thing is that the students will get the experience of actually manipulating and being able to see the different parts of the body and when they're studying anatomy and physiology.
So I understand not many universities have this. Is that correct?
That is correct, to my knowledge. Like I said, I saw it in a physical therapist department at another university, and they're fairly expensive as technology. But we were very fortunate that the university and the large tech grants helped us with being able to fund it and be able to maintain it. So of course, there's a maintenance component to it as well. So we're thrilled to get it. We just got it in. We haven't had it but a few months. So a couple of people know how to use it, but it's in its dedicated space. And we're using it right now for not only our students, but also doing tours of the university. So we think there's going to be a lot of interest in seeing it and being able to use it as one of our show and tells.
Okay. So you mentioned health sciences. What else are you excited about in that department?
Well, we have the BS in health sciences is a new degree. It just came online, and it really is going to focus on students who are interested in public health. If that area of background, they can take up to 21 electives in any of the health sciences. So they can tailor their degree. Specifically, we were looking at their ability to be able to go on to other graduate programs after graduation. So, for example, if you're interested in occupational therapy, then when you go and look at graduate programs, you can make sure that you take all the classes that you need to be eligible to apply for that program. So that would be PA school, physical therapy, occupational therapy. Those are the ones that we typically refer to as pre-health. So that degree really tailors that those courses that they need for that program, but it's also meant to be for community health educators. So people who are interested in being employed and teaching about health and wellness at a community setting or in an agency setting, then the degree meets that need as well. So we're excited about that. We also were approved for the MS in athletic training, which is required by their accreditation, but we just got that approved, and we're in the process of working on getting all of our coursework and what we need developed to be able to start that.
That's awesome. Well, Dr. Carruth, thank you so much. I really enjoyed our conversation today, but it looks like we're going to ask some questions that the alumni have for you. Also, remember, if you want to ask a question, just click the little button at the bottom, the Q&A box at the bottom, and go ahead and submit your question. So here's one from, it looks like it's anonymous. How many degrees will I have to get to become a pediatric nurse?
A pediatric nurse or a pediatric nurse practitioner?
It says pediatric nurse.
Okay. Well, sure. So you, if you want to work with children, you can go through our undergraduate program. Our undergraduate BSN program is designed for what we call generic students. And when you're finished, you have had an opportunity to work in all of the different areas. So you will get to spend time with children, but you'll also spend time with adults and pregnant women and delivering babies and all the different areas. And then you would be employed for a pediatric unit in a hospital or in a physician's office that focuses on children. So you would be eligible to work as a pediatric nurse when you graduate from our program.
Okay. Here's another question from Dickie Whitson, an alumni. In what specific manner can alumni best support the Southeastern nursing program?
Oh, very good question. Thank you. We are very blessed to have a lot of support in a lot of different ways. But one of the ways that we count on is that our nurse practitioners who graduate from our program typically stay in the area. Our speech pathologists typically stay in the area. And so they serve as preceptors and mentors for our students. And so we're very, very blessed to have a continued relationship in that regard. And of course, we have people who are not, they didn't graduate from any of our programs in our college, like Mr. Whitson, who is also a huge supporter of our program and who help us with our community outreach. And that's another way that we like to work with our alumni as well.
Okay. So another one from alumni Michelle Biggs. How is enrollment overall in the college and what areas have grown?
That's a very good question. Our enrollment has grown. I can't say exactly what percent it has grown, but it has gotten larger. Of course, we've added some new degrees. We've added MS in child life, which has only been in existence for a year. We just found out yesterday that we've been approved for an MS in population health management, which will be coming online in another year or so. So we have enrollment through new programs. Within the last 3 years, we started the health systems management program. And within a very short period of time, we went from no students to about 145 majors right now. So that has been a tremendous growth in that one particular area. So our nursing program has always had a lot of interest. And we admit a cohort, so the numbers stay relatively the same, but of course we try to graduate every single student that we admit to that program. So we have tried to add a few more nursing student position or slots to that group, so we graduate a few more. So all in all of our programs have increased. Some have increased more rapidly than others, but they're growing. So we know there's a tremendous need for health professionals in our community.
All right, it looks like we have one more from Brad. How do you measure student success and career readiness?
That's a very good question. And it's a question that we talk about all the time. Of course, success is defined by graduation, but that's not the only way that we measure success. So we look at within each program, we're tasked and encouraged to look at what are the skills that someone needs at graduation to be successful in this area. And so we measure and we monitor and we trend the data with those skills to make sure that our students are what we call successful by being job ready and career ready. And it's not just about the degree that you're getting, but it's also the type of career that you're going to have after you graduate.
Okay, we have one more question actually. One alumni asked, what's the master's degree in child life prepare a student for?
Very good question. I just had a long conversation with the coordinator of that just an hour ago. It prepares you to work in typically a hospital setting, in a children's hospital specifically. Although they work in other areas, they might work in a daycare center or other areas, but they're really looking at children who are getting ready to go through, let's say, surgery, or it might be children who have had an experience where they use different treatments to engage with the student to try to, the pediatric patient, to either lower their anxiety level or to educate them about something. And I'll give you a specific example, like play therapy is used very extensively with child life specialists to really help them get over their anxiety before they go into surgery. So that's not the only thing they do, but that's an example of what you would do in that area. So in the undergraduate, we have a pathway for a certificate, toward a certificate in that area. And that's been one of our fastest growing enrollment areas. And so we know that there's an interest in the master's degree in that area as well.
Okay, well, I know I keep teasing you at the end of this interview, but we have some more questions that keep popping up. So Luann, an alumni, asks, can you explain the accelerated nursing program option and the RN to BSN program?
Okay. The RN to BS program I touched on a little bit, but that's somebody that already has their RN certificate licensure. So they're a nurse because they went to a 2-year program or a diploma program. So they come back to school because they're interested in the BSN, getting the degree. And we know that people have more career opportunities if they have the BSN degree. So they might be working in a hospital on a unit, and then they want to come back because they want to further their degree, or they might want to go back to graduate school and become a nurse practitioner or other type of master's prepared nurse or doctorate prepared nurse, whether that's nursing education, nurse anesthetist school, etc. So they'll come back to get that minimum requirement before graduate school, which is their BSN. And then we have a very interesting program, the accelerated program. And this is students who have a degree in something else. Sometimes it's called a second degree program. And somebody that might have graduated in biology or in art or in any other degree, once they meet their prerequisites, like every other student, they will apply and they will be admitted into a very fast program. It's accelerated, meaning that within 18 months, they will graduate with their BSN. So they take the same courses that our other students take, but they take it, they start and they go in interim. They go fall, spring, they get a month off at Christmas or the same break at Christmas, but that's the only break that they get. So they go in the summer, they go in the interim, they go fall and spring. And so they finish within 18 months. So it's it's been a very successful program. We have close to 100% of our students that finish that program are licensed as registered nurses. So very, very successful because, when they come back, they've already been successful in one degree. And so they're usually a little older, a little more mature, and they have ability to go through at a very rapid pace. So we love that program.
Okay. So CJ wants to know if the college reached out to some of the registered nurses alumni who were emotionally stressed after caring for COVID-19 patients.
He wants to know, did we do that?
Yes.
I'm sure that we did, but probably not in a formal way, only because we've probably been dealing with our own stress with COVID-19. I do think that that is one of the biggest challenges, though, of COVID-19 is the impact that it's had on physicians and nurses and other healthcare providers. And I don't know that we've had time to really stop long enough to really analyze the long-term impact that there might be with that process. So our nursing faculty are fairly connected in the community with other providers. So I know that they have reached out. We have been very fortunate that our faculty and our students have been allowed to go back into the agencies to continue their clinical experiences. So our faculty are there with the providers, and I know that they've provided as much support as we've been able to and through that process.
Okay. Here's another question from alumni Brad. What was your most rewarding college experience?
You know, I was just your traditional nursing student. I would have to say graduation and pinning. Those are always two of the biggest events that most students, you know, engage in that are very rewarding. The nursing program has an annual, or every semester we pin our graduates. So they have something that they leave with, and it's commemorative, and it's also a tradition that we have. We welcome our students into the profession. So it's very meaningful. It's very intimate. Families are there. So I would say that my pinning ceremony, much like the pinning ceremony that we have every semester, was my most favorite memory.
Awesome. So thank you so much again, Dean Carruth, for joining us and telling us a little bit more about the College of Nursing and Health Sciences. And for our audience, we hope that you'll join us tomorrow as Dean Paul Summers Calderon from the College of Education joins us with Coffee with the Dean segment at noon on Zoom. It's all a part of Southeastern's Homecoming Week here at Southeastern. Don't forget to line up. Thank you so much for joining us. I'm Kaylee Norman. Line up.